All right, I would like to make a motion to reconvene into open session.
So, second.
All right, roll call vote. Peter?
Aye.
Elizabeth?
Aye.
Eric?
Aye.
Andrew?
Aye.
Susan Manning?
Aye.
Susan Fox?
Aye.
Lorene? Aye. Ayes have it. Motion is carried. And so we have action regarding closed session business as appropriate.
I would make a motion for approval of waiving liquidated damages for breach of individual teacher contract as presented during the closed session.
Second.
Okay, any further discussion? All right, roll call vote. Peter?
Aye.
Elizabeth?
Aye.
Andrew?
Aye.
Susan Fox?
Aye.
Susan Manning?
Aye.
Eric?
Aye.
Did I miss anyone else? All right, Lorene, aye. Ayes have it. Motion is carried. All right. Next order of business. Are there any public appearances?
Nope, there are none.
Okay, great. All right. Can I have a motion for consent agenda?
I'd make a motion for approval of the consent agenda.
I second. I won.
All right, we can go ahead and do a roll call vote. Susan Manning?
Aye.
Peter?
Aye.
Elizabeth?
Aye.
Andrew?
Aye.
Susan Fox?
Aye.
Eric?
Aye.
Lorene? Ayes have it. Motion is carried. All right. Nexus Recognitions.
Okay, for recognitions this evening start, we would like to mention that we are thrilled to be welcoming back staff and students to the 2021-22 school year. Our new teachers will receive orientation and training during the week of August 23rd, and then all faculty and staff will return on Friday, August 27th, with the first day for students on September 1st. We have several recognitions related to Monona Grove athletics. We have Monona Grove 2021 graduate Henry Walsh played in the 2021 Wisconsin Football Coaches Association All-Star Game in July. Monona Grove High School rising star Tyler Dahlhauser was named a part of the 2021 Associated Press Spring Season All-State Football Team. Monona Grove High School rising junior Madeline Hogan placed second in the heptathlon at the National Junior Olympics track and field meet in Jacksonville, Florida last week. The meet was hosted by USA Track and Field, the national governing board for track and field in the US. And then lastly, we'll have coming up shortly a report on summer school, but wanted to recognize that we had over 700 students participating in a variety of summer school courses this summer, from cooking and video production to music and STEM. And our summer school ran from June 21st to July 16th. And then there are some photos attached for you to view as well.
Thank you, Dan. Next are correspondence and announcements.
Lorraine, I had a question here. We did have 3 letters that are printed here for us. And the first one that was sent to all of us earlier in August, the person requested that it be read at the beginning of the meeting. So he didn't go through we had the old process where they had to be here it didn't occur to me to respond and point out that if he wanted it read during public appearances, he might want to come, but I think he was assuming we would read it out loud. And I'm just wondering if I'm willing to do that, if that's your understanding too. We did get 3, but the other 2 didn't ask to have theirs read. They just wanted us to read them all. But his started off saying, please read this letter at the beginning of the August 11 meeting before any voting takes place on the SRO program. So
Sure, I think, Dan, you have some additional information.
Sure. Actually, we've had other individuals as well request to have letters read. And you might recall that the board had that discussion when we switched to the virtual meetings about, and at some meetings for a while, the board was reading letters. Now that we have a mechanism that we can take public comment virtually, we've gone back to the policy that individuals certainly can enter or submit written correspondence as well, which we assure them that will be seen by the board. And we have corresponded with each of these 3 individuals to let them know that the board would receive this written comment, but they would not be read.
Okay, as long as you've corresponded, that's fine. Thanks.
Thank you, Susan. All right. We can move on to administrative reports.
Okay, if it's okay, I apologize. I'm going to actually go in reverse order. The first 2. So I'd like to start with summer school. As was mentioned in the recognitions, there is a memo that has been shared with you from our Director of Instruction, Lisa Hype, who coordinates our summer school programming. And so I think the memo is pretty self-explanatory, has the historical numbers as well, recognizing our individuals who served as coordinators. And all in all, coming off the pandemic, we're very pleased with the way that the summer school ran this summer. And so I'll just pause and see if there's any questions on the summer school report from you this evening.
No questions.
Okay. All right, and then working backwards, item number 2, virtual learning options update. So what I shared with you is a document that was shared with just the families who did request a virtual option. And this is something that we requested families to make their intention or share their intentions with us at the beginning of the summer. The rationale for that was so that we could do planning over the summer, not knowing how many families we might need or students need to serve. And so again, our team and led by Lisa Hype to coordinate this, we're really believe that we found a good option for the students who have made that virtual request, partnering with Wisconsin Virtual School. The one thing that we really like about Wisconsin Virtual School is run by CISA 9, so it's not a for-profit organization. They've been doing this for many, many years, and they do have certified teachers that will basically deliver instruction very much like we, many schools tried to do last year with the virtual. But again, this is something that I think, again, the memo states pretty clearly. We believe that we can match up the courses for our secondary folks, and then as well as likewise our curriculum K-5. So again, why don't I just pause there, see if anyone has any questions about the virtual instruction option that we'll have available.
Elizabeth?
Thanks, Lorraine. The only question I had, Dan, is I know that we had surveyed parents at the end of the year, and certainly we were in a different position in June than we are now. Are we going to re-offer options for parents who may have changed their mind and want to keep their kids virtual?
So great question. At this point, we have had throughout the summer, actually, a number of parents who have contacted us and said, we'd like to reconsider, and we have been able to accommodate those requests. So at this point, we are able to do that. If they become, it becomes overwhelming, we'll have to re-examine that, but that's our intent at this point, to honor and be able to place students, yes.
Susan Fox? Oh, you're on mute.
I need to keep that mug right in front of me or something. So I guess I'm wondering partly how many students total we have middle and high school at this point. And then also I assume there's a cost, but I assume we're not charging parents since this is something we're offering them, right?
Yeah.
Okay.
Great question. I'm sorry for not sharing that. I should have put that in the document. So at this point, we have 27 students total, and the cost right now is $1,600 per semester. And Lisa, is there an updated number? That was the last one.
Yeah, we have 37 students who are considering participation in the virtual programming across K through 12. Most of the students, if we're looking at a concentration of them, are at the high school level, but there's certainly a sprinkling at the different grade levels throughout. The price that Dan just quoted is for the elementary participation. It's slightly different. They charge per course for the middle and high school.
Elizabeth?
I just want to clarify that this doesn't impact our enrollment numbers, right? Like they're still technically Monona Grove students.
Correct.
They're just accessing courses differently.
Correct. The curriculum will be provided through Wisconsin Virtual School. They remain our district students.
Thank you.
And
Susan,
with regard to the comment you just made about the cost per course, is that per course regardless of whether we have 3 students in it or 1, or is it per student per course, or?
For elementary program, it's $1,600 per student
Okay.
per semester.
Okay.
And
that's
for secondary students, I believe it's $280 a course per
Okay.
student. High school students take 7 courses in a semester. Middle school students take 10 courses per semester.
Okay, thanks. That's helpful. I just to get an idea. And that seems like a good solution to me. It'll be a more comprehensive program for them and free up our staff to work with the in-person students. And so if these people decide to come back at some point, say after the first semester, I assume we could accommodate that as well, right?
At this moment, we've only communicated about fall of 2021. We have not communicated in any official way about second semester. We've just let families know that we'd be monitoring the safety and healthy environments of our communities and schools, and we'd make some decisions in the coming months.
Okay, sounds good. Thank you.
all right, Dan, there's no other further questions.
Okay, thank you. All right, then the third item that I'd like to spend a little bit of time on this evening is with regard to the school operating plan, specifically our protocols that we'll have in place as we open the school year. And you've had some information that's been shared with you, as you know, that the last few weeks some of the guidance has changed, and again the research continues to emerge, particularly with regard to the Delta variant. And so what I wanted to share with you tonight is a little bit more background information about how we get our information besides what's produced publicly with regard to the guidance. That's very clear, right, from the different organizations. But more kind of the behind the scenes about who are some of the other individuals that we're talking to help us understand the rationale for those decisions. Because last year when we were under orders, of course, it was pretty straightforward. If you have an order, this is what it was. And as much as we were trying to learn and understand that, we also want to make our decisions not entirely just about the guidance, particularly if we don't get the same guidance from different organizations, and to help us really understand what's behind that guidance and why, and how does that specifically, impact children and staff for that matter in a school setting. So the one thing I guess that I would want to point out, and I think was shared in the documents that you received previously, is currently, for the first time in this 18 months of the pandemic, all of those organizations are aligned in their guidance. And so that's certainly reassuring, for us. And I've listed the names and information for some of the individuals that have been joining us in our weekly meetings with our Dane County team and all the other schools. And particularly with the Department of Pediatrics at UW, Sabrina Butteris and Greg DeMurray have been extremely helpful in helping us, again, kind of understand the research and rationale and so on behind these recommendations. So at our last meeting, we spent time talking about the specific, why is it different with the Delta, variant, and how is that a game changer? Why did that cause these groups to these organizations to change their guidance? So they and particularly Dr. Shelby O'Connor actually put together a short video specifically for board members in Dane County, knowing that we're dealing with this decision making. And I put the link into the board docs, but I think it's worth taking a few minutes and just playing that short video, just so that we all have a common understanding of what is going into the decision making. And so if you don't mind, I'd like to just play that brief video right now. Katie's going to help me out, I believe, by showing that. Her technology skills are a little better than mine, and to make sure that we get the audio working.
Were you able to hear it just now? Okay, let me try it when I'm not muted. Let's see if that works.
My name is Shelby O'Connor, and I'm a professor at UW-Madison. I've listed my contact details on this first slide if you wish to reach out to me after you listen to this presentation. For the past year, our team at UW has worked to improve our local response to COVID in Dane County and Wisconsin. Some of you may actually remember me because I worked with several of your school districts in the spring of 2021 to distribute BNAX Now antigen tests to schools when they were not otherwise available. But today I'm here to share my thoughts on the Delta variant of SARS-CoV-2 and describe how its arrival in the community has changed the mitigation strategies that we and other experts think are necessary to prevent overwhelming our hospitals with cases of COVID-19. So what makes the Delta variant different from other variants? Well, it is because it is so much more transmissible. I'm going to give you a couple of data points to help explain what we know and why we think it is more transmissible. First, there is more virus sooner after infection. In China, they tracked an outbreak between May 21st and June 18th. They've tracked 167 cases, and all of them traced back to the first index case. They found that the time when contacts became PCR positive was about 3 to 5 days sooner for the 2021 epidemic compared to the one from 2020. And they also found that people infected with Delta had more virus on the day they were positive, as shown on the right. That graph shows that in orange, people who had the Delta variant had more virus, which is lower on the y-axis, compared to those who were infected with the 2020 virus, shown in blue. They had less virus, closer to the top of the y-axis. In addition, we know that there are mutations in the virus that improve its ability to infect cells. It's a very detailed piece of information. But when SARS-CoV-2 infects cells, shown on the left, there are two cutting events that need to happen. One of them happens in the spike protein at a site called the furin cleavage site. If you look at SARS-CoV-2, on the right, you see that it has a unique set of letters in the spike protein that make it different from MERS or the original SARS. This PRRAR sequence is very good for cutting. The Alpha and Delta variants of SARS-CoV-2 have slightly different letters at this site. Alpha has HRRAR and Delta has RRRAR. This RRRAR sequence is really good for cutting by this particular enzyme. This makes the virus infect cells better, which leads to faster and higher amounts of virus replication in an individual. Now, many of you are probably vaccinated, and that's great. That means your risk for infection is low, and I'm sure many of you know, however, that people can still get infected despite being fully vaccinated. How do we know this? Well, we are seeing both breakthrough cases and non-breakthrough cases rise in Dane County. You can see here the rate of infections for vaccinated and unvaccinated individuals since February of 2021. The rate of cases among vaccinated individuals has never been higher than it is right now, and it's rising. This is at the same time as Delta has become the prevalent virus in Dane County. People used to think that those who got infected despite vaccination would have a lower amount of virus, but this is also not true. In fact, the vaccinated individuals have just as much virus as unvaccinated individuals when they get tested. Here you can see, again, the relative amount of virus for those who were or were not fully vaccinated across 11 Wisconsin counties. On the y-axis, less virus is near the top and more virus is near the bottom. You can see that the amount of virus detected in both groups is very similar. So should we be worried about kids getting sick with the Delta virus? Yes, and you can see examples of this in Florida and Texas. So in Florida, there's been a rapid rise in hospital admissions among kids 0 to 17 in just the last few weeks. Even when Florida didn't see a spike last winter, that's not the case now. There's a huge spike. And you can see several headlines that comment on this issue. Same thing has occurred in Texas. They have had a rapid rise in hospitalizations, and it's been scaring many of the clinicians. In fact, this has been the case in the capital, Austin. And many of you may say, well, could this happen here? We're not Austin, Texas. But in fact, Travis County, where Austin, Texas is located, has 58% of the population vaccinated, and Dane County has 68% fully vaccinated. Both counties have more than half the population fully vaccinated. So it's just as likely we could experience the same rise here in Dane County. Now, while there are, of course, these immediate concerns to kids and rapid rises in hospitalizations, there are also concerns that kids are susceptible to long COVID, which we're just beginning to learn about now. This story actually came out in the New York Times yesterday. It describes how 11 to 15% of kids are getting long COVID, and even about 10% of kids simply have COVID symptoms for 5 weeks and sometimes even 12 weeks. So my recommendation is that there should be universal masking in K-12 schools to reduce disruption of school activities. On the left, you can see an illustration of how masking prevents transmission between individuals who, from one who might be infected to someone who's not infected. So masking is going to reduce the likelihood for individuals to spread the virus, reduce the likelihood for school outbreaks, keep in-person learning operational, and keep in-person school services operational. Now, many of you, I'm sure, don't want to wear masks forever. So I do believe there's an end game. CDC actually has a quantitative measure of transmission in a community. So I think that when cases are low, as shown in blue or yellow, masking does not need to be as severe. But if you look at the country right now, most areas have high transmission, where there are between 50 and to more than 100 new cases per 100,000 individuals over the last 7 days. And in Dane County, this is currently 110. So I think that by considering how and when we wear masks, flexing our mask wearing as the levels of transmission change, we can hopefully avoid the devastating surges we're seeing in Texas and Florida, so that our kids here in Dane County can have a safe, productive, and fulfilling school year.
Okay. So I would ask for questions, but again, of course, I think that the information is pretty self-explanatory, and I guess what's most important is, again, how have we used that information as our team has put together our planning. So I think at the end, when we talk about the end game, I think it's really important that that we continue to monitor on a not only weekly, but almost daily basis about what is happening. We all know that's what science is about, right? Seeking the truth, finding more information to make more informed or better informed decisions. And so the metrics, of course, we know that we were kind of fooled by them last year. We had what we thought were reasonable metrics. They turned out to be perhaps not the ones that we should have been looking at. But I think, again, a year later, we have a lot more confidence in what those mean. So I think continual monitor, continual communication here as we go along. The most important thing I guess I want to impress upon you as board members tonight is the ultimate goal is having kids in school, right, in person. And so if by wearing masks and doing the other protocols will mean keeping kids in school, that's what we need to do. And when it comes to things like, quarantining, if we do have positive cases, there are two really important factors. We know that being vaccinated is really important. That can possibly eliminate quarantining, as well as having our staff and students masked to eliminate or reduce the amount there. So those are really important things that also keep our kids in school as well. So why don't I pause and see if any questions or comments regarding operations and planning and so on.
Eric?
I guess the question is for Dan, but also for the rest of the board. Back in February, we voted as a board to follow Dane County Public Health guidelines. And that changed some of the things about going back to school. Recently, with the new message that went out, the board didn't vote for anything. So I'm wondering if you just maybe can clarify, because I've had questions like, why did the board vote before, and now that we just got an announcement without any input or discussion of the board? So Dan, can you maybe clarify some of that, just procedurally, how that works and why we are where we're now?
Yeah, absolutely. Great question. So as you know, last year, as we were dealing with school closures, okay, we made that that was something the board determined when we were going to open schools, close, and so on. The operational plan that went along with that, as far as the mitigation strategies and so on, was not something the board ever voted on. And so we've continued that. Now, I do want to make it clear, and you know this, as board members, of course, you have the authority to determine what you do or don't want to. So by policy, it's not by default, this is part of the school operations that we do. Because of this nature, if that's something that the board wanted to be involved in, and that there are boards, throughout the state that have chosen to take action on plans. And so that's something as a board, if you decide that you would like to do, we certainly can entertain that. One of the challenges, of course, is that this plan, is constantly evolving and being updated. And so it would likely mean a lot of special meetings every time we had, an update. So, but that's a consideration.
Thank you.
Peter?
Yeah, I just want to thank you, Dan, first of all, for putting out this comprehensive plan. I think it looks pretty good at this point, given what the information we have. And I know it's a tough decision to mandate maskings, and we're going to get we're hearing some feedback about that, but I think it's important, considering all the data that we have seen, that I think it's very important to keep our kids safe, that we, especially Elizabeth, because she's having somebody right now, that we do the masking. And I want to emphasize the importance of the masking actually over everything else. The data is getting clearer and clearer all the time. That masking is the key to this. Even with the Delta variant, the masking is the key. I would like to ask a question about for the staff mandating vaccine, and would like to have us have a discussion if that's an issue, no later than when the vaccine receives full FDA approval.
And what I can share is, as you know, there've been no decisions about that. As far as what are the research that we've done, of course, looking, talking to our legal counsel about what can and can't be mandated, how do we collect that data? And so we do have that information. What some districts are doing is asking staff and students, for that matter, to affirm, whether or not they've been vaccinated. And that was certainly something that prior to the guidance changing a few weeks ago, where the initial guidance was that it was not required to wear masks if you've been vaccinated. That was another important factor, perhaps, in knowing that. So I think to Peter's point, that is something that we need to continue to talk about, what that does look like in the future. So we're not ready to make a recommendation, but we are gathering data about how we could go about that. And I agree that's something that would be a relevant discussion.
Susan Manning.
Yeah, thank you, Dan. And I would also add that what they're finding, and I've seen the data out of another major state university, is that on the breakthrough cases, particularly from the Delta, the mask is critically important because they can actually carry the virus even though they're vaccinated. And so if you say those who are vaccinated do not have to wear a mask, and often they're asymptomatic, but they're seeing numbers of breakthrough cases and then tracking that the exposure was from a vaccinated individual. So the mask continues to go both ways.
Elizabeth, and then Susan.
Thanks for sharing that video, Dan. I really appreciated that. I thought it was really clear and understandable. I actually have a question for Krista. Krista, are you on today? Oh, hi. It's Elizabeth with questions for Krista. That time of the board meeting.
Wonderful. Yeah.
So one of the pushback or points of concern that we've been hearing from parents a little bit is around kind of social emotional concerns, right? So social emotional concerns that come with mask wearing, and certainly some behavioral concerns around compliance around masks, maybe especially for our students who struggle with, sensory challenges or difficulties or other things that may make that uncomfortable. So a couple of things. One, a few meetings ago, I asked you if you saw a spike in any kind of social emotional concerns or behavioral issues as a result of the mask. And I feel like you told me not that you were aware of. I just want to confirm that was true. And then my second question is kind of what are we continuing to do with schools coming in person to monitor social emotional mental wellness components of it, and then also from a compliance perspective, particularly for maybe our students that have disabilities or who otherwise where compliance with a mask may be problematic for a variety of reasons, kind of what our plan is there. So that was like a lot, so I can repeat those for you, but it's sort of like trajectory of social emotional health and masking.
Yeah, yep. It is a lot. So let me know if I forget something.
Oh, you know, I will.
So I do, as far as I think your first question was around, do we have evidence that there were a lot of like social emotional implications or an increase in behavioral, our data, like referrals or incidences related specifically to mask wearing in schools? And I can say, of course, the principal, could weigh in on that as well. But no, we don't have data. I mean, behavioral data or hard data to show that we demonstrated any sort of like noticeable increase across the board. Do we have we had students where we had to do some problem solving around mask wearing? Yes, but it's not a large number of students. I mean, I think you've heard me say it before, but our students really, and the principals could weigh in on it too. Like as a whole, and again, I know last spring is different than what we're walking into in the fall potentially, but our compliance rates were strong. A few reminders here and there is what the administrators were saying. The handful of students, with who might have needed some support or a plan to work toward building tolerance. I mean, those are the things we did, right? Like work toward building tolerance, layer in other mitigation strategies if a student truly was unable to wear a mask for an extended period of time or at all. As we want our students in learning in the classrooms where they belong. So we would continue to do that. I think that was part of your question as well. So I think there are individual cases where we would continue to like build those plans and, increase tolerance, practice wearing it. Our teachers are so creative. I mean, incentivizing, we had teachers helping students pick out a particular mask that they were incentivized to wear. So we talk about it as directors and colleagues in Dane County. We're all sort of looking at those standards and working toward keeping everyone safe and keeping everyone in school and making sure that those individual students have that layer of protection too with the mask. So we worked on it. We will continue to work on it. Remind me your question about kind of monitoring, like.
Just how are we going to keep an eye on it? Because spring was different than fall. And I think there was, I think you won't get as much mask fatiguing because you weren't there for as long, right? You weren't there full days all the time, so I just kind of curious about what our monitoring plan is around that. If you've thought of one yet.
That makes sense. I think it's a yes and question. Yes, we've thought of it, and we will continue to refine that because you're absolutely right. It's a bit of a different circumstance with just the amount of time and what we're asking students to do, and it's sort of a longer haul, right? We don't know when we're going to be done with masks, but the mask breaks and being really clear on the guidance, using that outside time, encouraging those mask breaks. That was great for summer school. We were doing that by the end of the year as well, but really building those in, encouraging the students to take that and having good routines around, getting the masks back on and working through that. So, I think we have plans to sort of monitor like how students are doing socially and emotionally, like in their well-being. We have talked about that as far as just kind of our normal routine, but also keeping some of those things from last year, the check-ins, the social emotional focus, the community, the advisory groups, and community circles, the places where we had just check-ins on how students were doing. I'll stop there because that's probably about all where we are for right now.
Yeah, that was perfect.
It's definitely a conversation we are continuing to have. And now that we know what fall is going to look like, that changes our planning just a little bit with that mask focus. Sure.
Yeah. Thank you, Krista. And certainly principals, I wasn't trying to leave you out. So if you have things to add, you're welcome to it. I just always assume Krista's the holder of all aggregate behavioral data for the district. But certainly if you have things to add. Last question I have, and this one is for you, Dan, around supplies. And so the extent to which we'll have disposable masks for adults and as well as kids available for kids who may forget to bring one or may need one or may chew through theirs?
Well, I actually can't answer that, but actually it's Krista and Jared who are in charge of making sure that we have those in place. But yeah.
And I use the chew through one as a personal experience because my little one that just gave, he just chews through those things like it's going out of style.
Yeah. So, but yeah, we absolutely will have available.
All right, Susan Flex?
Yeah, thank you. Good questions. Because that will be something that we'll have to just continue to monitor, I think, because it's harder to keep it on for longer periods. But I guess anecdotally, what I was hearing is that kids are really pretty good about it. And you know, those of you who have your own children have commented on that too, that once they get used to the expectation. You know, I think just from the few, we haven't had a real onslaught of emails, but one of the questions raised was, or there was an assertion made that masks don't work. And I think it's really important that we message that, yes, they actually do work. And there's a lot of evidence to that. And I think the other point to be made is that our priority this year is to get kids back in person, full time, every day. And the best way to do that is to have everybody wearing masks. Short of having everybody vaccinated. I mean, if we could get everybody vaccinated for sure, we might, given the Delta and the other things, we might still have to wear masks for a while, but that would certainly help if everyone was vaccinated. But I think it's really key. You know, I've heard doctors a couple of times in different either podcasts or on TV talk about the analogy that because we're also getting questions about why aren't we doing what some other districts are doing, where we're leaving it to the parents to decide whether their child should wear a mask. And the, I think, obvious answer is because you wear a mask not only to protect yourself, but to protect everyone else. And given the danger of the Delta variant with kids, as well as with staff, the analogy was made that telling parents that it's up to them to decide, so you have some kids wearing masks, some kids not, is a little bit like saying, okay, in the swimming pool, you can all pee over here and only in this one corner, because obviously it's going to go all over the pool. If those of us who are old enough remember when you could smoke in the back of airplanes, the smoke went through the whole airplane. And the same thing is true with masks. That's why we have to wear them. I thought it was an apt analogy, and I think it's just very clear. So I'm pleased with this. I know, and I have the same question that Peter had about having a conversation about mandating vaccines among staff. I just heard another doctor from Johns Hopkins come out today saying he thinks it is time to start talking about that on a national basis. That was clearly, we know our state won't do that, but I volunteered at Overture and we had our usher training this week, and they are mandating all volunteers, all staff have to be fully vaccinated, meaning 14 days out from the second vaccine by October 1st, or you may not volunteer there. And if you're a staff member there, they'll have to put you somewhere where you don't interact with the public, and you'll still have to have tests. So I think, we're seeing that more and more places, and I think it's something we should seriously consider at some point.
Thank you, Susan. Dan, we also received a question regarding whether this is legal or not. Is this legal?
Yeah, no, great question. So yes, and it, we've confirmed with our attorneys, it's really akin to having dress codes in schools, right? And so it's that simple as far as the expectations, and not to be flippant about it, but it's no different than, no shirt, no shoes, no service, right? It's the same, type of thing. When we get into things like mandating vaccines, of course, that's a whole different thing. And that, of course, would be a board approval type thing. But as far as the expectations, we have all kinds of things that are hygiene related that we have expectations are in school, and this is no different.
All right, we have no other questions. All right, moving on to board reports. Ad hoc Sustainability Committee, Peter.
Hi, let's see. Sorry, wasn't expecting that quite that fast. The committee met, when did we meet? Last Thursday, and there's some actually since then, there's been some unfortunate news, which is there's been a COVID outbreak in the factory of the company which we have a contract with. They've had to rejigger in one of their factories. They've had to reconfigure their production schedules, and unfortunately, we are not. Right now, it looks like our panels would not be coming here till November, which could be a problem for getting them up on the roof this year. There's continue to work on what's going to happen with that high school solar project. The committee is continuing with planning for the outreach components that we are considering. How to bring the public along, how to educate the public, but most importantly, how to provide information that other school districts in Wisconsin can use to do the same thing, because it makes a great deal of financial sense, but there's just this barrier that people don't know how to do it, don't understand it, and the drive here. What we want to do is to make it the norm for everybody to do, and make it easy for them to do it by leading the way and by showing people how to do that. So that involves us doing a lot of outreach, quite a bit of outreach, putting together information, making it available to other schools. So we're continuing with planning on that front, and sort of that's where we are today.
All right, thank you, Peter. Next, we have the Monona Grove Education Foundation. Susan Manning.
I have an update on the Monona Grove Education Foundation, which met yesterday, August 10th at 4 p.m. The superintendent provided his report on construction, the budget, enrollment, and school reopening. They've received 4 thank you notes from scholarship recipients. And then effectively, they talked about the Great Golf Ball Drop, which is their major annual fundraising. It is slated for October 2nd, 2021 at 10 a.m. They're dropping 500 golf balls from Monona Fire Ladder Truck, with 19 balls closest and one furthest to the hole, winning cash prizes. There are going to be 500 tickets and 20 prizes. So, quote unquote, your chances of winning are sky high. So that's what they wanted you to know. The sponsor letters were all done, completed, and sent. The tickets are going to be $25 a piece, and you can buy tickets from the board members this week. And then online, I think will be starting next week. And again, these funds are going to benefit the Pay It Forward, which was a student-centered program, and the Teacher Innovation Grants. So again, the Pay It Forward is a new program to provide extra support to Monona Grove students struggling with food stability or clothing, and those needing additional tutoring programs and or assistance with virtual learning and mental health programs. And that's effectively what they did. Thank you.
That's wonderful, Susan. Thank you. All right. So now we're at possible action items. The first one is policy revisions, deletions of the second reading.
And if you want me to, Lorraine, I can just add, we've already done the first reading on this. The graduation requirements were effectively just a review. The 3 tech related policies were all reviewed and written by our tech team staff. So the policy committee and administration recommends the adoptions of the revised policies 5460, 7540.02, 7540.03, and 7540.04 as presented. I would make a motion that the 4 revised 5460, 7540.02, 7540.03, and 7540.04 be approved as presented.
Second.
It's been moved in second. Is there any further discussion? Okay. All right, we can move to roll call vote. Peter,
Aye.
Andrew,
Aye.
Susan Manning,
Aye.
Elizabeth. Oh, did you say aye? Didn't hear you. Okay,
Aye.
Susan. Okay,
Sorry.
that's okay. Susan Fox,
Aye.
Eric,
Aye.
Lorene, aye. Ayes have it. Motion is carried. All right, next is the high school course proposal for 2021-2022.
Okay, so the board approved a number of new courses back in December. That's typically when we do bring forth proposals for the board to consider. Like everything else this year, nothing is normal in our pandemic year. And so our staff has continued to look at options. And so even though this is not normally when we introduce new courses, we do have staff that brought forth a proposal to the high school for a digital music production. So with that, I'll turn it over to Principal Mcgrath and talk a little bit about that.
Sure, thanks, Dan. We're excited to bring this course proposal forward. With Carl Davik's leadership in that department, there's been conversations over the last couple of years about the desire to add a course or courses that don't require prior playing of an instrument and background like that to feel comfortable enrolling in and be part of our fine arts program and the music program. And this digital music production course would be open to all students, grades 9 through 12. It's a semester class, so it's not a year-long commitment for students. A lot of students are interested in and experimenting by themselves with things like SoundCloud and digital music production, and this would provide them a more robust opportunity to approach such a thing. So Cara Collins will be the instructor for the course.
Susan Fox?
I have a question. So when would this course be available, given that students have signed up for things? Are there some students who'd be able to juggle schedules to sign up yet this year? Are we talking?
You know, after we sorted out the sharing of staff and the staffing of GDS and the high school in terms of music last year, it became apparent that we had an opportunity to add a course with Cara Collins. And so we were already past the registration mark and course selection mark at that point. But what we did is we created the description for the course, and we sent that to all students saying you could still make a schedule change or choose this course as an alternate to the courses you selected, or replace a course that you selected with this one. I think we have about 6 students enrolled right now. We still have some new students, and we're also going to advertise the course with students in study halls to see if anyone would be interested and would rather take the course than a study hall. Ideally, with a course like this, we'd like to open it up with about 12 students. You don't want to open it up with 25 students based on the needs of the course. So we'd like to boost enrollment just a little bit more.
Okay, thanks.
Andrew?
There's no more questions. I'd like to move approval of the new high school course proposal for 2021 and to 2022 school year as presented.
Second.
Okay, it's been moved in second. Are there any further discussion? All right, we can go ahead and a roll call vote. Peter?
Aye.
Andrew?
Aye.
Susan Manning?
Aye.
Elizabeth?
Aye.
Susan Fox?
Aye.
Eric?
Aye.
Lorene, aye. Ayes have it. Motion is carried. All right, next is the School Resource Officer Memorandum of Understanding.
Okay, so as you recall, you had a special board meeting on August 2nd where you had an opportunity to have discussion amongst yourself as well as an opportunity with Chief Cheney Austin, Chief Labor, to join you and where they had an opportunity to provide input. So what you have for your consideration tonight is an MOU. And I just want to talk a little bit about procedurally and the document itself. And then we can talk about, if interested, the merits of it. So you might recall that a year ago, when it was up for renewal, that we did have it reviewed by attorneys and realized that it really needed a rewrite, just more from the attorney point of view, and as far as defining, the district's obligations versus the city and villages. And so we did have a short MOU for the remainder of last year when we reconvened in March for the last 3 months. And in working with our attorneys, we are recommending using the same language. For now, it does cover all the things as far as liability and so on. We also do understand that there's a number of things that we know that if we continue with this, that we do want to change and incorporate into the MOU, to be very specific about roles and responsibilities. But we also felt that it's really important that we do that in a collaborative and thoughtful nature instead of trying to rush to put something in here in the short term. And so all of those things, I want to reassure you that can happen, that the way this is written, your board policies are in control, that those will be followed. So until we do, if you do approve this, until we do a rewrite, you can adopt policies or procedures that will, and we can administrative as well, that will be followed. It's better to put them into the MOU for clarification, but you do have that option. So I just wanted to make that clear that is written into the agreement. Okay. The other real important thing with the agreement is the term. Both the city and village really wanted to have a 3-year agreement for budget planning and so on. But the reality is a real important clause that's in there is that either party can terminate the agreement with 90 days notice. So that gives you complete control that if at any time things aren't going the way that you would like as far as rewrites or with the program, it can be terminated. So there really is not a risk of having a multi-year agreement because you do have the control over that term at any time and moving forward. So that's kind of the legalistic part of it and policy part of it. That of course is very different than the merits of the program. But so why don't I'll pause there and see if there's questions or comments on that.
Dan, so I'm clear, you're saying that we can make revisions during this school year to the MOU? Yes.
So yes, either through policy that would be applicable, or we can actually revise the document itself, that would be our intention, is to revise it and bring it back for ratification, either as an amendment or a new MOU. And we've gotten assurances from both the city and village that they're willing to work with us on that. So I think that's important.
Thanks. Okay, Andrew?
I'd like to move approval of the memorandum of understanding.
I'm sorry. Peter, did you have a question?
Oh, that's all right. Andrew can make his motion. I was under the impression that Dan had more to add to this discussion. He just wanted to talk technically about the program first, about the MOU first, and then he had more to add. So if that's the case, because he said I'll pause there. If that's the case, then I'd like to hear what else he has to say before we go to approval.
Oh yeah, okay, go ahead. Dan, did you have anything else?
Okay, well, I guess I'll just start with just that with regard to the merits of the program. Okay, you heard a report from a number of people in our team. You've had your own discussion on that. And the one thing that you haven't heard up to this point is a recommendation from me. I think I said that, in this is a very difficult decision. I don't feel that I have any additional expertise than everyone else at the table with this. But I do think it's important that I share, where I land on this at this point. I still have reservations and concerns about whether in the long run, officers really are needed in the school at either the high school or middle school level. but I also am extremely encouraged by what I've heard from particularly our new chief in Monona, and really would like the opportunity to incorporate the changes that we've talked about and continue to assess as we go along. So given that, I am recommending that we do approve this MOU with that understanding that we are going to continue to evaluate. This is not a long-term necessarily the decision that we need to continue to reevaluate at a minimum on an annual basis, but I'd like to work with the board even on what that review process looks like, up to that. So.
Peter?
Okay, so well, given that, thanks. I guess I'll start. So after the last year and the review and the discussion we've had, I'm disappointed to see that we have essentially the same MOU back with additional legalese about liability and so on, without any of the what I thought was very productive discussions we had about the program sort of encapsulated this. And yes, we can make changes, and the reason we can make changes is because we can drop out of it at any point in 90 days, which is another, if we say propose a change and it's not accepted, then then we can drop out of the agreement. But that seems a rather crude approach, and the fact that we don't see these changes or even an expectation of changes in the agreement is, to me, I think, problematic. After all this time, we're sort of back to this, what I see with the MOU as the status quo. And I think we all agree, for example, there should be, and if you look at the Department of Justice, what they tell us about SROs, there should be training requirements. And I think that we should, in the MOU, at least it should lay out that there's an expectation that we'll develop a training, some sort of training requirements, and that would be binding. That would be a requirement for the SRO for the, so that would be something that would impact the police departments of both the city and the village. For example, I'm also very interested to hear and to see and maybe incorporate some of the changes that Chief Cheney Austin suggested. But again, I don't see either any of those changes in this document or any anticipation of those changes in the document. Nowhere in the document says we expect to see, we expect for something to happen by a given time or given date. And I really don't want to go back to the status quo on this. Absent sort of those, an updating, a real updating to the MOU in terms of the substance rather than just the legalese on liability and so on. I would really like to see these changes, and I think these changes have to be there to make sure that this goes on. And I will get back to the point I did make, which is I made the last time we met, which is the data is really clear that SROs have a negative effect on what we in Wisconsin have a big problem with. We have the nation's largest problems with disproportionality, and disproportionality and the gap in graduation rates, going to college, and these are the factors that SRO programs seem to have a negative effect on. Not seem, have sort of clearly have a small but real negative effect on for students of minority students. And the fact that here in Wisconsin we're worse at that than any place else in the nation does not suggest that somehow we have our magical thinking about, well, we're better than Texas or North Carolina or someplace else where they've done the studies because, where Wisconsin is valid. In fact, the data that we have says both here in Wisconsin and consistent, and the data is consistent with the Monona School District, we expect it to be a worse problem given our data than other places. And we can't wish that away. And the other thing is that SROs don't seem, there's not any good evidence that SROs improve security in schools. That you can't come up with any sort of, and there's been lots and lots of people trying to find that, and they can come up with anecdotal evidence, but when you try and put it together in any sort of a fashion that produces a pattern that the SROs are improving security, you don't find that. And so I just think that this is an opportunity for us to do better for us to move beyond this and find something better by our students. And here's something that's driving me. In the time I've been on the school board, we have never had a student injured or killed through violence, through some sort of violence action that in our schools. However, we have had suicides. And so I would say to my board members that if we want to protect, if we want to provide real security for our students, if that's a goal, then we're barking up the wrong tree, and we should do something a little different, or maybe a lot different, to try and improve the safety and security of our students. And part of that, I think there might be some ways we can reform the SRO program, but I also think that we should really seriously consider alternatives, such as using these resources to find a way to provide mental health resources to our students. And I'll stop there.
Thank you, Peter. Elizabeth?
Yeah, I 100% agree with you, Peter. And I agree that, when I opened up the MOU, I was also disappointed and really surprised. I was like, this feels like exactly sort of what we've talked about a year ago. And I would say, in addition to the things that you cite, I think there are a couple of things that are additionally concerning to me. One is a large focus of the conversation we had around evaluating SRO was what their role is and what their role is not. And although I think there's some language in there around like the disciplinary aspects of it, there's this whole missing role, like this whole missing component around utilization in lieu of mental health supports, utilizing SROs, particularly at GDS, for building relationships with students, and things that really ought to be student services or school staff facing roles. And I don't see any change in the MOU around the parameters of like, you can do this, but here's where you draw the line, or here's who's even in charge in these particular situations, right? When we talk about, the power structures and dynamics of a student who might be having an acute mental health issue, and the SRO gets called and the school counselor psychologist gets called, like, who the power differentials there aren't neutral, right? So then who ends up taking over? And I think that we had a really missed opportunity here. And I know I'm going to sound a little bit like a broken record, because I think I've said this at every SRO meeting I've been a part of, to really look at our SRO program as part of our entire continuum of supports of students, from prevention to like that type of intensive intervention, and see where our gaps are. Because I think it was very clear through all of our conversations what people really not only exclusively wanted. I think high school is a little bit of a different discussion, and I would be interested in separating GDS and elementary and high school and having those as separate and distinct discussions, because I do think the issues there are different. But nonetheless, like when you hear staff talk about how they utilized our SROs, the primary utilization for them was for, low-level behavioral issues, which is a systems problem that we need to address, and connections with kids and some acute mental health stuff, both of which are inappropriate. And so I think what happens is when you don't look at it within the context of the entire system, we looked at it in a vacuum, we haven't solved for any of those problems yet and haven't resolved the issue over here. And so, I'm in agreement with Peter around wanting to see something different, so that we can actually say, okay, yes, here's the difference in these parameters. And then, yes, we'll work on some policy solutions and these other things. But if the solution was going to be that we develop policy solutions as a board, like we could have worked on that a year ago. Like we could have actively been working on that, now, and then this meeting would look a little bit different. And so that's sort of my thoughts there, in addition to what Peter said. And like I said, I'd be interested, and I posit this to my fellow board colleagues, around having a separate discussion around the needs at Monona Grove High School versus elementary up to middle school, where you're talking about kids and pre-adolescents essentially, and kind of what the utility is of having a police officer present there outside of establishing relationships with kids, which I don't think is an appropriate use of an SRO.
Susan Manning, and then Susan Fox.
Dan, thank you very much for adding your thoughts to this. And thank you very much for the work that you've done on this and bringing the team. I mean, listening to the principals, Mitch and James, was incredibly helpful and thoughtful to me and how those roles are being played out. And I appreciate the research, but when you do research, there's always cases that don't fit the facts of the research when you do a study. And it was my impression from both the chiefs that our program wasn't necessarily like the ones in the studies. So that was helpful to hear. And I think what you seemed to say tonight is that we have an incredible opportunity now to take on a program and modify the MOU as we feel comfortable. And technically, you know, I think what we want to do is modify it while, as we go forward. So I'm not concerned about having it all modified now. Plus, I want a group of people to be involved like you were doing. I appreciate that. And I also think if you look at Elizabeth and her thoughts, and we hear Susan Fox's thoughts and your thoughts, and we can expand this in any way we want to, we have an opportunity to work on policy that will help us reaffirm the positives we want in this program. I appreciate you helping us understand that. Thank you.
Susan Fox?
Yeah, I think it's, I just want to point out that this MOU was pretty significantly revised from our previous one. And this one just went into effect when our students went back to school, when we recontracted with the SRO for the last 3 months of the school year. So it is different, and it did, you know, I agree that there needs to be more, but it definitely points in that direction, and it corrects some of what I guess I think a couple things. One, I think a lot of the studies that we read relate to larger urban schools that I don't even see our school reflected in those studies, to be honest. Our district, just over the years of it and experience myself in the schools. I think that, you know, we've had, I think we all agreed, and we had a lot of discussion about this, that the way our SROs were being used, at least in some situations at the high school, when you read through those reports, was not appropriate, was not what we wanted. But I think we also said that was on us and on administration for not paying attention and not laying out the guidelines. So I agree with both of you that yes, we do need to be more clear about that. We heard Chief Cheney Austin say that very clearly, that he would like those guidelines. I would be comfortable with this MOU because I do think it's quite superior to what we had before. And, you know, he said, for example, real flatly, that no SRO under his guidance from the police standpoint would be doing some of the things that the SROs have done in the past, just because I think, you know, there was a lack of clear expectation. And so I think if we were to decide to approve this and give maybe even a target date like October 1st or something, because I do think there should be a broader committee, and I think the police should be involved in it, as well as staff, some students, teachers. What should be, the role should be limited, and I don't think it's going to be a real lengthy thing, but I think that could happen. I guess I've heard too, you know, when you look at the surveys, by the way, you look at the students who had positive described the relationship between the SRO and students as positive. Even with the students of color, it was pretty close to 50-50 between positive and negative when you look at those surveys. So I guess I think that lends credibility to my saying it's not exactly the way it is in other areas. And I think even that, does the SRO make you feel safer? Again, with students of color, was pretty close to 50-50, yes and no. So I think we do have a different situation. And I think what we're talking about going forward is kind of a different role, is a more, you know, for them. We also don't have anything in place. And I think what I've heard from some at least one social worker parent who talked to me, and then from just my reading and what I think some of the input we got, is what we really need is both. The social workers have different roles than police officers do. I've heard anecdotally, I know there were a couple incidents where families were not happy with how their student, the interactions between their student and the SRO. A couple other instances where they were extremely grateful, not just happy, but grateful, because they felt the SRO went out of his way to spend a lot of time and talk about the legal aspects. They're very different kinds of things. There are also situations when you talk about none of our students getting violent. We don't, we haven't had violent incidents. That's true. We don't know, when you head things off, you don't always hear about it. I guess that's the other thing I'd say. And I know there are at least one or two incidents where students, had the SRO not been there, a police officer would have been called. They probably would have been taken into detention. That didn't happen because our SROs were there to deal with them. And I think that whole thing, when they talked about, both police chiefs talked and we've talked about relationships, and it's easy to gloss over that and say, well, does that really happen? I don't know. I think there are cases where the SRO, knowing the student, can act more proactively. And if they're in a situation where they have to act reactively, still have the ability to act differently than a police officer coming in from the outside who doesn't know the student, doesn't know the family, doesn't know the circumstances. It's a very different situation. And I think we shouldn't lose sight of that. So I guess, and we also don't have a plan in place. So we're going back to a year that may be very fraught for all kinds of, we're still in COVID, we're still dealing with all this stuff. We don't have another person to hire. We can't right away hire a person to replace an SRO. So it's we would be losing two adults that currently do have very strong relationships with their kids at a time when I'm not sure we can afford to lose them. So I guess I am personally in favor of moving forward with this and moving forward quickly. However, I will agree that I was a little disappointed too that we hadn't talked, that there weren't more specifics, but this committee had a charge and they had to act pretty quickly to do the work that they did, getting the input and making a recommendation. And it's a little bit different matter to say, okay, now what are the parameters going to be? And let's get more prescriptive and more specific about it. And I think that has to be done promptly. I don't want it to go on all year. I think we should set a deadline, but it has to be reasonable. And I'm all for, if you have a job, get it done, and give, maybe it's a few months, but then okay, schedule some meetings, get it done. Anyway, I guess that's where I am. I don't think I have anything else.
Eric, I do see your hand. I just have a quick question. Dan, so will we have oversight throughout the year, just to monitor how things are going with the officers?
So the answer is yes. What that looks like, though, is yet to be determined. So that is something that I think is important, that we have that discussion together with the board about that oversight. And that's one of the things that has to happen. If I could just say just real quickly, every point that's been made, I think, is really relevant and valid. I would ask you to remember what the conditions were under in this last year when we're trying to do this evaluation. We really don't have the capacity, or didn't, to do that in the time frame that we're talking about. The rewrite of this MOU as it is now was myself and the attorney. That's it. And we did the best we could with understanding what our policies are in place. And this is a major rewrite, the things that we're talking about, that I shouldn't be doing in seclusion. It should be a lot of people involved, and it's going to take some time to do that. So I agree that those things need to happen, but to have it at this point in time, we just didn't have the capacity to do so.
Just to follow up on what you just said, Susan Fox kind of suggested like an October deadline. Is that something do you feel that we could do? I know I just threw that out there.
That might be too ambitious too, but by end of the year, I don't know. I think we should talk about, and we should get input on what Dan thinks is realistic, but I just don't want it to drag on all year. I think.
I'm in agreement. We should set a timeline and what has to happen this year by when. Okay. And that might be just a separate discussion to figure that out.
Great. Eric?
Well, I have two things. The first thing is I'm real hesitant to trust, or I guess trust the right word, rely on us making changes. Back in September 2020, I had a number of changes that I submitted for the MOU, and none of them have changed. Not one of those things have went into the current MOU that I'm looking at now. Not one suggestion. I had many. So I don't know what the process of that would look like, but we would have to outline that pretty specifically, considering that was brought up before and nothing happened about it. And I went, I made it a point to read through everything and to write notes and submit those as was requested by us, and nothing was done about it. And now I'm looking at an MOU which has none of those suggestions, nor were they discussed. So I'm concerned about that. And I guess the other question I have is, well, there's two more things. I don't like the 3-year agreement at all. I think it should be a 1-year agreement. I don't care if it can be renewed at any time. I don't see the point of having a 3-year agreement when it's not needed. It should be a 1-year agreement. And then, Dan, my last question is, if this was not voted on by the board, or it was determined that we would not be renewing this contract, can that same amount of money be used for mental health or social work services? Because I know that's something that keeps coming up, but how is that money allocated, and can it actually be used for that if that was the case?
Yeah. So to answer that question, in general, no, this is paid for out of our community service fund. And so we would have to find something that is community-based. So it's not unequivocally no, but when we talk about things like a social worker, that's an absolute no. You can't utilize the funds for something like that. So we'd have to find something that would be a community-based position.
So a community-based social worker.
I mean, all you would have to do is make that resource available to say anyone under 18 in the district. And then it becomes, I mean, our aquatics director is community funded. Our auditorium director is community service funded. And that's because seniors, people can come in and use the pool, people can come in and use the auditorium, and we make this available, this resource available to the community. And I think it's perfectly reasonable to say, well, if we have kids in the community who don't attend our school, but want to find a way to make to access the resource and making that available to them, I see that that's a way to make that fundable out of community service fund. The other thing was, I asked both of the chiefs at our meeting what things that they did that were community-based to justify that program being paid out of community service fund. And all of the answers they gave me, 100% of them were serving students or staffs in our schools or in activities related purely to the schools and not serving the community. So I think if we carefully design some sort of social work, some sort of program that had a community program, I think we could, without too much difficulty, overcome that barrier. I understand that barrier is real. I think we can overcome that barrier. Sorry, I jumped in there without raising my hand, Lorraine.
No worries. Peter, you have another?
And I want to comment. I'm not saying that I know that there isn't a role for SROs, and certainly I don't want to cause a disruption with what we're doing, and I know that the SRO program has become an integral and important part of the way we deal with students in schools. And so we have to be careful about, and I understand the need to be careful about disruption. However, all of the things we talked about, I believe we'll need to look at this a little harder, and I believe that the MOU needs to have in it an anticipation of the things Susan talked about, which is that we expect improvements moving forward, and this is scheduled. This is the sort of expectations that we're going to have. And one of my suggestions was, for example, that, and I put a deadline, the end of the year or something, that there will be a training document. There will be a mutually agreed upon training document that the SROs need to execute when it's practical. And I think that this is essential, and I'm reliant I'm reluctant to just rely on, yeah, we'll do it, because it's so easy for things to get, for the next crisis to come along, and for things to get put off, if nothing demanding it, and just end up doing the status quo because it's the easiest. Anyway, thank you.
Dan, does the contract have to start right at the beginning of the year, or can we change the MOU and then start it at that point?
You need to get an agreement with the village and city. So if they would mutually agree upon a different date, then you can start it whenever you'd like.
Peter?
I'm just going to say, I mean, we do still have a little bit of time left in August to get for us to meet again, to talk about it, to bring something back if necessary, quickly. Hearing the discussion and my thoughts, I think that there's possible room. We don't have to come up with any, I think we don't have to make any decisions other than we want the MOU to reflect that we are expecting change and some timelines and the parameters around what those expectations are. So I don't think that that's so difficult a thing. For example, to say we expect a training document, not without having to go through and determine in the next week what the training is, just that we'll have one by the end of the year, for example.
Susan and then Elizabeth.
Well, there is an impact on the municipalities who are trying to do their budgets, because this has, if we decide not to, for sure, they have to fund another police officer, perhaps not hire someone, that kind of thing. So we have been kind of stringing this along for a while. So I think we owe them an answer, and it's either, to me, it's either a yes or no. And that's part of the reason for the 3-year too. They need to think more long-term. So.
Elizabeth?
Yeah, I mean, I appreciate that concern, Susan. I certainly don't want to be like, I don't want to be disrespectful of that concern. And I want us to recognize that like, this is a contract that we're engaging in, right, for a service that we want. And so the consequences on the municipalities to me is less important than the consequences for us in terms of what it is and looks like in our spaces. And I recognize that there are consequences to municipalities. So Eric, you bring up a really good point. I didn't really think about that, because I also offered edits and suggestions. The MOU, DPI has a model MOU for SROs and some guidance language. So I guess, Dan, I want to loop back on Eric's question, which I feel like was stated rhetorically, but like, I want to state it like sort of actually and plainly around. So we had suggested changes earlier. They weren't made. It is what it is. But like, why is this time different than that time?
Yeah. And so let me just say this. Every suggestion that was given to me was written into a draft and shared with our attorney and shared with the attorneys from the village and the city. I probably wouldn't be appropriate right now to talk about why it's something, and how that, but I think it'd be important to have that conversation, with that. So.
Plus, I don't recall ever any board discussion about any individual suggestions that were made. There may not even be board agreement to all those suggestions. So there needs to be a real process. It can't just be we all shoot off our suggestions and expect they get incorporated. I think.
Yeah, I agree, Susan.
I'm sorry. I just need to say this. Just as a reminder, please raise your hand. So okay, thank you. Elizabeth?
Sorry, Lorraine. No, I totally agree. I totally agree with you, Susan. But part of the reason why I wanted to ask was because if the attorney, let's say, vetted those things and determined that wasn't the best course of action, then like our suggestions don't really matter, even if we had board consensus around it, right? Like if we all say like, yes, we need a training plan and DPI recommends these 5 basic trainings and they should go into the plan. And at the end of the day, Dan and the attorney come back and say, no, we're not going to put that level of specificity inside the MOU, then we're sort of back in the same spot. So I do think it might be useful to like bring those things back up to know kind of what the barriers were to even contemplating those things in a draft. but I agree with you. We need like a board discussion around it. So I wasn't trying to circumvent that process, just trying to like figure out the logic of like what happened from point A to where we're at right now.
Okay, Eric and then Susan Manning.
Well, we did have sort of a board discussion on it in September 2020. I think it was the first week of September where we met, and that's how the whole thing came up. I don't know the exact dates. I didn't go back and look at the minutes. I'm just looking at my notes. The other thing is, I also agree with Elizabeth that if an attorney has said certain things cannot be in there, I would like to know that, because I confirmed a bunch of my suggestions and questions last week when we met with the police chief. So, and many of them they said could be done. There were some that couldn't, but a lot of them could have, and they both agreed that they could have. So, I guess that there's some gray area there that confuses me if an attorney looked at it and said they couldn't be done, and then the police chief says they can. So that's a little concerning.
Susan Manning.
I think it would be helpful to schedule in a week a workshop and have all the board, again, it's important to have us provide input, but one person's voice, as we've reiterated this evening, with 6 others may be different. So I think it's helpful to have the list of recommendations for change that other board members made, to be able to see the legal response to that and to work on this. The other thing is, it may be that they don't want it on the MOU, but it might fit into a policy. So again, that discussion is important in understanding if a change a board member recommends isn't legal, doesn't support that in the MOU, we may, as a board, support that in the job description or in a policy or in other ways. Again, this is a great opportunity for us as a board to really review this, look at what we do well and all the things we want to do better, and see those happen and build a model program. And I think we have staff who want to do that. Mitch and James both talked about that. We have 2 chief of polices who want to do this with us. One of the chiefs wants to form a safety committee with family, teachers, and administrators in each school building. I mean, there's so much now we could do if we move forward. If we shut the door, we'll lose these opportunities. And I just think, again, with the expertise on this board and the caring and the experience they have, we could do some really neat things.
Elizabeth.
Agree with that.
Oh, you didn't have a question?
That was it. I just wanted to say that I appreciated that, Susan, and I am in agreement with that thought and idea.
Susan Fox.
Well, I guess I'm not sure. I think a workshop in a week is particularly valuable. I don't think we're going to know any more then than we do now, because I think what we before we got into discussion of individual board members' suggestions that apparently didn't get included, we talked about the need to have a broader discussion involving students, teachers, family, to work on those parameters and come to some agreement on the parameters. And that clearly takes more than a week. So I guess I just don't think that's necessarily going to it doesn't make a lot of sense to me. I think we're spinning wheels to meet again in a week. I don't think we're going to say anything different than we are already. So
Susan Manning.
I think the other thought about the week is to do exactly what Susan just talked about, to form ideas of where we want to go and a time frame, goals, an action plan and a time frame for going forward, and looking at exactly what Eric was saying. Look at a time frame. Look at the things that are really critical to us to finding full support of the program. This is a chance for us to make this happen.
Peter?
I just wanted to note that the MOU doesn't mention policy, our policy, anywhere. And it's difficult for me to understand how, if we implement a policy, it becomes part of this MOU, other than we would have to say to the police departments, we will implement this as part of the MOU, or we're going to withdraw from it, which doesn't seem to me a good way to do business.
Do we have a motion on the table?
No. Can we get a motion, please? Elizabeth?
Sorry, I wasn't going to make a motion. I was just going to tell Peter. I think it is in there, Peter, under applicability of district, city, and village policies. Did you get to that page?
When I searched for policy, I didn't use the plural.
Yeah, use the singular. It comes up in singular, policy.
No, well, I'm searching. I get, you're right.
Yeah, there's four instances of it under applicability of district, city, and village policy. So it says parties recognize that activities set forth in the MOU are subject of certain district policies and administrative guidelines, village and city policies, police department policies. These policies and guidelines include, but are not limited to, district policy and administrative guideline 5771, and then it lists.
Yeah, I got it. I see that paragraph. Thank you.
All right, I just wanted to clarify that for you, Peter.
Yeah, for some reason my search did not go to it. I'm a little annoyed at Adobe for not doing that. But okay. Oh, I'm not in the Acrobat. I'm in my browser. That's why.
Technology.
All right, can someone call a motion? Susan?
I'll move approval of the memorandum of understanding regarding school resource officers between Monona Grove School District, Village of Cottage Grove, and City of Monona as presented.
Second.
Okay, any further discussion? Okay, a roll call vote. Peter?
No.
Andrew?
Aye.
Susan Manning?
Aye.
Elizabeth?
Right.
Okay, Susan Fox?
Aye.
Eric?
No.
Okay. Lorene? Aye. Ayes have it. The motion is carried.
Then can I just add that we may, when we get to the end of the meeting, when we talk about future meetings, we may want to talk about a meeting sooner than our next August meeting to talk about these follow-up things that need to happen and a time frame. Unless, Dan, you want to be prepared to make a recommendation in August?
Yeah.
I think is the best way to move forward.
I do think a special meeting or workshop specifically for this item might be relevant and one of the things that might be helpful before we begin any policy work and MOU is perhaps have the attorney meet with the entire board as well. So we can talk about the process about how we're going to move forward with this.
Okay.
Okay, next is the scheduling of regular board meeting locations.
Okay, so you might recall that annually at the board reorganization meeting, one of the statutory requirements is for you to establish the meeting schedule of your regular meetings, including the location and time of your meetings. And so during that meeting on April 26th, at that time, we put in, you see the motions that were made, and it was determined that the board would meet virtually. So in order to have in-person meetings, you would need to take action in order to do so. And so we did as part of that motion, it was stated that the board should will revisit during this summer. And so it's for your consideration this evening You can choose to take no action, which means you would continue to meet virtually. You can choose to take action to have a meeting location, or something in between. So it's up for discussion and possible action.
Peter?
Seeing as I had a potential household exposure to COVID and we just haven't got the test back yet, so we don't know, I would encourage, unless you all want me to come in and breathe on you, I would encourage that we take no action at this time and let the situation develop. I would also say that when I look at, and maybe it's the unusual year, but when I look at the public access, for example, the number of views, the 15 people who were watching this meeting just a minute ago, the 60 or 70 people who watched our last, the Monona TV in our last meeting, and up to 300, actually there's one meeting from January at 676 views. The feedback I'm getting, I believe that we have better public access right now doing this virtually than we do when we're meeting in our room. These Zoom meetings, I think they work better for public. They make it easier for the public to access and see what's going on. So I would encourage us, certainly for now, to take no action at this moment. By the way, that's my primary concern when it comes to this, is that public has good access to us. I believe that that is paramount. And but I see it looks like we have better access. They have better access than they had in the past. So
They have the same access. It's the same. They've always had online access.
I think the difference is in Zoom, because we're talking to our computers. It's clearer, easier to understand, easier to see than what happens, the video that ends up being produced than what happens in our board meetings. I get better feedback, and I see more people accessing these meetings, both in real time and after the fact. Just my thoughts.
Okay.
Yeah, I'm agree with Peter. We don't need to take any action at this time.
Susan Fox?
Yeah, I sort of feel ambivalent about it too. I was kind of leaning toward being in favor of going back to in-person meetings until, we had the whole the new variant scare. And I thought, given that we wouldn't have to wear masks at meetings, but if we have to wear masks at meetings, to me, it sometimes is a little harder to hear. I mean, in the reorg meeting, when we had that, I know there were a couple of times people had to take their masks off to be heard, and maybe we can do that. But I know with the city has moved some of their meetings back to in person, and we've had a couple of plan commission meetings. The last one was a hybrid. They have some new technology where that's better than, not exactly Zoom, but they can it can be a hybrid, and it worked way more effectively than I thought at the last meeting. But we did keep our masks on. That was at the request of the library, and it was okay. So I guess the main, I still do think there's something nice about in-person meetings in terms of some of the informal conversation that goes on before. And I mean, nothing official, but it's just a different feel. But yeah, Peter, you're right. The public access and the ability to listen, it's more convenient. I think I've had a lot of people tell me that it seems more convenient for them. They can kind of tune it in and out, just leave it on. And they just weren't as inclined to before, even though they could watch the meetings. So I guess the only real benefit I see is if we think there's an optics benefit, since we're requiring our staff to go back and wear masks, and maybe we should be doing that. I don't know. I don't feel strongly one way or the other. I'm fine leaving it this way for a bit longer. But the other thing is, if any of us are out of town, it's way easier when it's all on Zoom to still participate. But yeah.
I think I would support no action as well.
Sorry, Eric.
I don't, it's fine. It's fine. It's just when people talk about more access and stuff, it's not the case. There's been so many other variables related to the pandemic and very important decisions that people have been paying attention. I'm sure if there wasn't a pandemic and you couldn't be around a lot, you could be around a lot of people, the boardrooms would be full of people that are concerned about these things. So I just don't think it's a valid argument, but I'm fine with keeping everything as it is for now. But I think it's going to be an ongoing thing that's constantly going to be changing, and we should keep monitoring it because eventually we're going to get back to normal, and we need to change when the time is right and when it's safe.
I would agree with Eric that we need to revisit this. Definitely, especially if changes to the Delta variant takes place. Peter?
I would have to say that in my time on the school board, the primary, now it's easier, but the primary difficulty, the primary challenge was that it was time away from Wednesday nights, time away from my family and my kids. And that's a barrier to being and participating in the school boards to a lot of people in our community who I believe should have a place and should have voices on our board. The board should not just be, retirees, people who are beyond families. They should be people, and they should be people in our schools. And many of us are, but it's also more difficult. And I think that this is having these virtual meetings does make it easier for a larger group, a larger segment of our community to be part of the board. And so I'm not sure that I don't think that this should continue indefinitely, because I like the fact that particularly younger people with families find it easier to participate. I certainly would have found it much easier with my family.
Elizabeth?
I agree. And I also think we shouldn't take any action now for the reason that were stated. And I think it's an interesting thought experiment to think about access, or at least different access. Although I tend to agree with Eric that I think people are just more interested because the topics are they're very impactful and more impactful to a wider audience, I think, in a lot of ways, or at least feel that way to people. And nothing precludes us when we are able to go back in person to survey our community and see what their thoughts are on it too, Peter. So if people are actually getting more access, we can just get some data on it and then make a database decision around staying virtual or not, when the pandemic is done doing what it's doing.
Dan, just some clarity, we still have the option of coming in if we choose to, if we do no action today?
Yeah, so we still are noticing the meeting as a physical location at the district office. And so Joyce sets up a computer, it's being displayed there as well. Part of it is access, as you mentioned. Most people have access through their computers, but someone is able to physically come in and watch the meeting in our office, and that will continue. So I guess I would suggest that if you choose not to take action this evening, I think as board members, when you think you would like to see it back on the agenda again, you just consult and let Lorene know that, make a request to put it on the agenda, and then we can do that and pick up the discussion again.
Peter?
I would just comment, it would be a valid discussion under future meeting dates, which is always on our schedule. So anybody could bring it up at any meeting, I think.
Okay, there's no action then. All right, moving on to discussion items. Policy revisions, deletions, first reading.
Want me to kick it off?
Thank you.
Yep, this is a policy that is being recommended by the committee as well as the administration. The board or the committee actually, this was not an EOLA update per se. We actually had a parent that brought this policy to our attention. And so our committee really examined and determined that there really was a significant rewrite that was necessary. And in fact, this was one of those policies that we were not entirely using the Neola template. We had some of our own language that might have come from a previous policy. We weren't sure exactly where it came from. So I think the intent and the rewrite is a much improved policy that gets to, you know, the purpose of it, right? The relations that we expect with our parents in our school.
Well, and Dan, the only thing I would add as chair of that meeting was that it was a really, really good discussion. And we actually interfaced it with other things to try and determine, but again, it talks about expectations. And I mean, I think basically what we did was add clarity. And I would also note that I haven't received any written comments on this one. So that's still an available action before the next meeting for the second read. But at this point, we haven't received any written comments for revision.
Thank you, Susan. All right, no other further questions regarding that, so we can move on to school renovations, construction update.
Okay, so actually, since our last meeting, there are 2 executive summaries that the Findorf team put together. So you see a number of pictures that have occurred and with updates over the last 3 weeks, and I had a chance to walk through today with Peter Sandin from Findorf and look at as far as the Winnequa renovation. So everything is on schedule. The Winnequa and Cottage Grove schools will be right up to the timeline to get those done. It's amazing how things come together those last 2 weeks. But really excited to wrap these projects up. So I guess, are there any questions on any of the projects?
No questions.
Okay, so we've got our formal dedication of Granite Ridge next Wednesday. Really excited about that. And then by our next meeting, we'll have everything, wrapped up, because that'll be when the other renovation projects are to be complete.
Very exciting. Thank you, Dan. Right, next, our meeting dates. And we have access to that. And can I have a motion for adjournment?
Move to adjourn.
Second.
Can I just ask one quick question? Are we going to try and work on a separate meeting date for the SRO or not? We decided not to do that, right? I just wanted to clarify.
Yeah, can I suggest that if either it'll be an agenda item at the next meeting, or we'll schedule a special meeting? Can I and maybe work through that with Lorraine about what might work best?
All right, thank you, Susan. All right, we had a second already for adjournment, so roll call, or we can just do all in favor.
Aye.
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 Ayes have it. Meeting's adjourned. Have a good night, everyone.